Did you know that in just 5 minutes, 12 seniors will suffer a heart attack, and nearly half of them will be alone? I'm Dr. William Carson, and after 40 years as a cardiologist, I've unfortunately heard too many times the heartbreaking words, "I didn't know what to do." The reality is that 65% of heart attack deaths in people over 60 happen before they even reach a hospital, often because precious minutes are lost in confusion or denial. But what if I told you that learning 7 specific actions could double your chances of survival? Today, I'm sharing the exact life-saving steps that helped my patient Richard survive a heart attack he experienced alone in his garden last summer. These aren't just theories, they're proven moves that can make the difference between life and death. Welcome back to Life Advice for Older People, where we focus on the real challenges seniors face. I'm Dr. William Carson, and after 4 decades specializing in geriatric heart care, I've seen firsthand how knowledge truly saves lives. Heart attacks after age 60 bring unique challenges. Your symptoms might not be what you expect, and your body reacts differently to stress. What's more, the approach to surviving a heart attack alone differs greatly from what you'd do if others were around. I'll guide you through the 7-step protocol I teach all my patients over 60. When Richard, a 72-year-old, collapsed alone last summer, these exact steps saved his life. Remember, this information doesn't replace emergency medical treatment, it's meant to keep you alive until help arrives. Many seniors spend time alone, so knowing what to do in those critical first minutes can make all the difference. If you find this advice helpful, please like and share it with someone you care about. You never know whose life you might save. And if you're new here, subscribe for more essential senior health tips. Now, let's dive into the first critical step. Recognizing the unique warning signs of a heart attack in seniors, which are often very different from what you might expect. Many of us grew up thinking a heart attack means someone clutching their chest in severe pain. But for adults over 60, especially women, symptoms can be very different and often much more subtle. According to recent research from the American Heart Association, nearly 40% of seniors having a heart attack never experience the classic crushing chest pain. Instead, they show what doctors call atypical symptoms, which aren't really atypical for seniors at all. Let me tell you about Joyce, an 83-year-old patient who nearly missed the signs of a major heart attack last year because her only symptoms were sudden fatigue, mild dizziness, and feeling not quite right without any chest pain. Luckily, her neighbor recognized these subtle warning signs and called 911 right away. Here are the heart attack warning signs specific to seniors that you need to know. First, sudden unusual fatigue or weakness that feels very different from normal tiredness and overwhelming exhaustion without explanation. Second, shortness of breath, even during light activity or rest. If you suddenly can't catch your breath walking to the mailbox when it was easy yesterday, pay attention. Third, unexpected cold, clammy sweating not linked to temperature or exertion. Fourth, nausea, indigestion, or discomfort in the upper abdomen. Many seniors confuse this with stomach issues. Fifth, lightheadedness, dizziness, or confusion. In fact, sudden confusion can sometimes be the very first or only heart attack symptom in older adults. Sixth, unexplained pain or discomfort in places other than the chest like the jaw, neck, back, or either arm. And seventh, sleep disturbances or worsening fatigue in the days or week leading up to the event. Research shows many seniors experience these warning signs up to a week before a major heart attack. Women over 60 are particularly prone to these less obvious symptoms, especially fatigue, shortness of breath, and nausea. Have you ever experienced any of these signs and dismissed them? Let me know in the comments below. It's crucial to understand that recognizing these symptoms early and acting quickly is your first life-saving move. Many seniors delay calling for help because their symptoms don't match the dramatic chest-clutching scene from movies, but this hesitation can be deadly. Trust your instincts if something feels off, especially if you have several of these symptoms at once. Don't wait to see if they pass. Moving on to the next essential tip, call 911 immediately and do not drive yourself. This might sound obvious, but it's a mistake many seniors make. The moment you suspect a heart attack, your top priority is activating emergency medical services as quickly as possible. Every minute truly matters during a heart attack. According to the American Heart Association, for each minute that treatment is delayed, more heart muscle dies. After just 10 minutes, the damage may start becoming irreversible, and by 30 minutes, significant and permanent harm can occur. So why shouldn't you drive yourself to the hospital? There are 3 vital reasons. First, driving requires focus and energy, which puts extra strain on an already struggling heart exactly when it needs to work less, not more. Second, your condition could worsen suddenly behind the wheel, turning you into a danger not only to yourself but to everyone else on the road. Third, many people don't realize that once you call 911, treatment begins immediately. Modern ambulances are like mobile emergency rooms. Paramedics can give life-saving medications, perform CPR if necessary, and use defibrillators. They also notify the hospital so a cardiac team is ready when you arrive. One of my patients, Anthony, a proud and independent 76-year-old, ignored this advice last year when he felt chest discomfort and shortness of breath. He chose to drive himself to the hospital. Halfway there, he lost consciousness and crashed. Thankfully, another driver called 911, but those extra minutes cost him dearly and added to his injuries. Anthony later told me, "Doc, that was the most foolish decision of my life." If you're alone when symptoms begin, here's exactly what to do. First, stop everything and sit or lie down comfortably. Next, call 911 immediately even if you're unsure whether it's a heart attack. Let the professionals decide. When speaking with the dispatcher, clearly say, "I'm a senior experiencing possible heart attack symptoms," so they can prioritize your call. Then, unlock your front door if you can. This allows responders quick access if you lose consciousness. Lastly, if you have a medical alert device, use it alongside calling 911. These devices connect you to operators who can stay on the line until help arrives. What about calling family or friends first? Although it might feel natural, it only delays critical help. Always call 911 first, then loved ones if possible. Have you thought about what you'd do if heart attack symptoms struck while you were alone? Share your thoughts in the comments. Remember, calling for emergency help right away is not weakness or overreacting, it's a smart, life-saving decision. And as we'll cover next, what you do in the moments after calling 911 can make a huge difference. Tip number 3, take aspirin the right way. Timing and dosage are crucial. The third life-saving tip revolves around a simple medication you probably already have at home: aspirin. But how and when you take it can make all the difference. Aspirin is one of the most effective immediate treatments during a heart attack, yet many seniors aren't aware of the correct way to use it in an emergency. Why is aspirin so vital? During most heart attacks, a blood clot forms in a coronary artery, blocking blood flow to part of the heart muscle. Aspirin works by preventing blood platelets from sticking together, which helps stop the clot from growing larger. Research from the Journal of the American College of Cardiology shows that taking aspirin during a heart attack can reduce mortality by up to 23%, but only if taken properly. One of my patients, Sylvia, 68 years old, remembered to take aspirin when she experienced heart attack symptoms but made two crucial errors: swallowed the aspirin whole and drank it with a full glass of water. Both actions delayed the drug's absorption. When we reviewed this later, she was surprised to learn the correct method. Here's how to take aspirin properly if you suspect a heart attack. First, after calling 911, immediately take 325 milligrams of aspirin, which is usually one full-strength adult tablet or 4 81 milligrams baby aspirin tablets. Second, and this is critical, don't swallow the aspirin whole. Instead, chew it thoroughly before swallowing so it enters your bloodstream faster, typically within about 5 minutes compared to 30 minutes if swallowed whole. Third, take the aspirin with just a small sip of water, enough to help swallow it comfortably. Fourth, inform the 911 dispatcher and paramedics about the aspirin you've taken, including the dosage and time. Important caution: if you have an allergy to aspirin, a history of bleeding disorders, are on blood thinners, or your doctor has advised against aspirin, skip this step. Also, be sure to use actual aspirin, not other pain relievers like acetaminophen, Tylenol, or ibuprofen, Advil, as they don't thin the blood the same way. I advise all my patients over 60 to keep aspirin within easy reach in your purse or wallet, bedside table, kitchen, and car so you're not scrambling during an emergency. Did you know about the chewing technique for aspirin during a heart attack? Let me know if this was new to you in the comments. Remember, aspirin is not a replacement for emergency medical care. It's a supportive measure while waiting for paramedics. The combination of quick 911 calls and proper aspirin use has saved countless lives, and it could save yours too. In our next tip, we'll discuss the best position to place your body in while waiting for help, a factor that can greatly affect your chances of survival. Tip number 4. Position yourself for survival. Should you sit or lie down? This life-saving tip might surprise you because it goes against what many people think. Contrary to popular belief, lying flat isn't always the best choice when waiting for help. Positioning your body during a heart attack can greatly influence how hard your heart works and how much oxygen it receives. For seniors, this is especially important since the cardiovascular system is often already under more strain. Let me share the story of my patient Carlos, who is 77. When he felt heart attack symptoms alone, he remembered seeing someone in a movie lying flat during a heart attack, so he did the same. Unfortunately, this made breathing harder and put extra strain on his heart. Paramedics adjusted his position right away. So, what's the right position? It depends on your symptoms. If you're short of breath, a common sign in seniors, the best position is called the high Fowler's position, sitting upright with good back support and knees bent or straight. This helps your lungs expand fully, easing your heart's workload and improving oxygen flow. If you feel lightheaded or dizzy, a slightly reclined position at about 45 degrees, with your head and back supported, is better. This helps blood flow to your brain without adding stress to your heart. For nausea, another common symptom, sit upright and turn slightly to your left side to help prevent choking if you vomit. The main rule for all these positions is to avoid unnecessary strain. Don't stand or walk around while waiting for help. Stay stable so you won't fall if you feel dizzy or pass out. Also, loosening tight clothes around your neck, chest, or waist can help you breathe easier and improve blood flow. Another important factor is temperature. Heart attacks often cause cold sweats, and seniors are sensitive to temperature changes. If you feel cold, cover yourself with a blanket since shivering makes your heart work harder. Where in your home should you wait? Ideally, choose a spot near your unlocked front door so emergency responders can find you easily. If you live in a multi-level home and symptoms start upstairs, don't try to go downstairs. That effort can worsen your condition. Instead, call 911 and tell them exactly where you are. Have you thought about the best place in your home to wait for emergency help? Share your ideas in the comments below. Remember, these positioning tips are temporary measures to ease your heart's burden while waiting for professional care. They don't replace actual medical treatment. Next, we'll cover a technique to help manage pain and anxiety during a heart attack. Another crucial factor that can greatly affect survival rates for seniors is controlling your breathing using the 4-7-8 technique. This fifth life-saving tip targets something we do automatically but must consciously manage during a crisis. Controlling your breath can reduce heart strain and calm anxiety. During a heart attack, panic is natural. Your body floods with adrenaline, your heart rate spikes, and your breathing becomes rapid and shallow. For seniors, this stress worsens heart function and limits oxygen flow precisely when the heart needs it most. My patient Vivian, 71, credits this controlled breathing for helping her survive until paramedics arrived. She said, "When I felt pressure in my chest, my first instinct was panic, but remembering the breathing technique calmed me and gave me something constructive to focus on while waiting." The 4-7-8 technique, developed by Dr. Andrew Weil and supported by cardiovascular research, is simple yet powerful. Here's how to do it during a suspected heart attack. First, sit comfortably with back support as discussed earlier. Place the tip of your tongue against the ridge behind your upper front teeth and keep it there throughout. Exhale fully through your mouth with a gentle whooshing sound. Close your mouth and inhale quietly through your nose to a mental count of 4. Hold your breath for 7 counts if that's hard. Hold as long as comfortable, even just 2 or 3. Finally, exhale completely through your mouth for 8 counts, making the whooshing sound again. Repeat at least 4 cycles or until help arrives. Why does this help? The extended exhale activates your parasympathetic nervous system, or rest and digest system, which counters the panic response. For seniors in cardiac distress, this can lower heart rate, slightly reduce blood pressure, and improve oxygen use. Studies in the Journal of Emergency Medicine show controlled breathing can reduce pain perception by up to 28% during heart events. More importantly, less anxiety means less adrenaline surging, reducing heart workload. This technique also gives seniors a sense of control, aiding clearer thinking and communication with emergency responders. Have you ever used breathing exercises during stress? Share your story in the comments. Remember, this technique doesn't replace medical treatment but can be a powerful tool to extend your survival window while waiting for help. It's also a tool you can start using immediately, without any equipment or prior preparation. Now, moving on to our next tip, we'll cover a controversial but potentially life-saving technique that should only be used in very specific situations when experiencing a heart attack alone. Tip number 6. Self-administer chest compressions if necessary. This life-saving tip addresses an extreme circumstance that requires special knowledge how to perform chest compressions on yourself if you begin to lose consciousness. To be very clear, traditional CPR cannot be performed on yourself. It's physically impossible to deliver effective chest compressions while unconscious. However, there is a modified technique that might help in extreme cases when you're alone and feel you're about to pass out. This technique is somewhat controversial in the medical community, with some doctors hesitant to teach it. But after 40 years as a cardiologist, I believe seniors should know all available options. My patient Samuel, age 74, used this method when he felt himself blacking out during a heart attack alone at his cabin. He later told me, "I was sure I was going to die, Doc. Trying this gave me a fighting chance until my neighbor heard me and called 911. Here's how to do the modified self-compression technique. First, if you feel faint while waiting for emergency help, immediately lie down on a hard surface, preferably the floor, not a bed or couch. Next, make a fist with one hand and place the knuckle side directly over the center of your chest on your breastbone, sternum. Use your other hand to push your fist firmly against your chest, then release. This motion should compress your chest about 2 inches deep. Aim for a rhythm of roughly 100 compressions per minute, about the beat of Stayin' Alive by the Bee Gees, which is the rhythm taught in CPR classes. Continue until help arrives or you regain consciousness. Why might this help? Standard CPR manually pumps blood when the heart is failing. This self-compression technique can potentially keep some blood flowing to your brain and heart if your heart enters a dangerous rhythm. While it's not as effective as CPR performed by another person in a life or death moment alone, it may provide a critical lifeline. Important cautions. This technique carries risks, especially for seniors with osteoporosis or past rib fractures, as it could cause rib injuries. However, when the alternative is death, most medical professionals agree attempting this is reasonable. This should only be a last resort. Your main focus should remain on calling 911, taking aspirin if advised, positioning yourself correctly, and practicing the breathing technique we covered earlier. Have you ever learned CPR or emergency response skills? Share your experience and thoughts in the comments below. Share your experience in the comments and let me know if you think more seniors should be taught emergency cardiac procedures. Remember, the ideal scenario is to receive professional medical help as quickly as possible. All these self-administered techniques are temporary measures designed to extend your survival time until proper medical care arrives. Now, for our final tip number 7. Prepare in advance by creating a personalized heart attack action plan before you ever need it. This may be the most important life-saving step of all. During a heart attack, your thinking can become clouded by pain, fear, and the physiological effects of reduced blood flow to your brain, which can impair your ability to make quick decisions. For seniors, this cognitive impact is often even more pronounced. My patient Louise, age 79, credits her advanced planning with saving her life. She created a detailed action plan and reviewed it regularly. When she experienced heart attack symptoms while alone, she didn't have to think, she simply followed her plan step by step. Having a plan I could follow without thinking made all the difference, she told me. Here's how to create your personal heart attack action plan. First, prepare an emergency medical information card listing your full name, age, medical conditions, current medications, allergies, emergency contacts, and doctor's information. Keep one copy in your wallet and another in a prominent place at home, such as on the refrigerator with a magnet. Second, place aspirin in strategic locations around your home and in your purse or wallet. Use actual aspirin, not Tylenol or other pain reliever sand, preferably the non-coated type that can be chewed quickly. Third, program emergency contacts into your phone using ICE, in case of emergency, before their names so first responders can find them easily. Many smartphones have emergency medical ID features. Take the time to set these up. Fourth, consider using a medical alert device, especially if you live alone. Options include pendant-style alerts and smartwatches with fall detection and emergency calling. Fifth, clearly mark your house number so emergency vehicles can find your home quickly. Reflective numbers visible from the street can save critical minutes. Sixth, practice your emergency response by walking through the steps we've discussed. Know where you would sit, where your aspirin is stored, and how to unlock doors quickly. Muscle memory can take over when your thinking is impaired. Finally, have a conversation with family members or neighbors about your plan. If you live alone, consider arranging regular check-in calls, especially if you have known heart conditions. Review and update your plan every 6 months or whenever your health or medications change. One additional step especially important for seniors: discuss with your doctor whether you should keep nitroglycerin at home, a prescription medication that can help dilate blood vessels and improve blood flow during a heart attack. Creating this action plan puts you in control, helping you act quickly and decisively during an emergency. For those with diagnosed heart conditions, nitroglycerin is a prescription medication that can dilate blood vessels and improve blood flow during a heart attack. Have you created an emergency plan for yourself or an elderly loved one? Share your experience or questions in the comments below. By preparing in advance, you're not living in fear, you're taking control of your health and significantly increasing your chances of survival if an emergency occurs. Let me tell you what happened to Richard, whom I mentioned at the beginning of this video. At 72, Richard was an active gardener who lived alone after his wife passed away. One afternoon, while working in his garden, he began experiencing unusual fatigue and pressure in his upper back. Because we had previously discussed warning signs specific to seniors, Richard recognized these as potential heart attack symptoms. Instead of brushing them off as gardening strain, he immediately stopped and activated his plan. He called 911 first, then chewed an aspirin he kept in his pocket. While sitting in an upright, supported position, he focused on his breathing using the 4 to 7 -8 technique we discussed earlier. Most importantly, he had unlocked his front gate that morning, a habit he developed as part of his heart attack action plan. Paramedics arrived within 12 minutes and immediately began treatment. At the hospital, doctors confirmed Richard was having a significant heart attack with a 95% blockage in his left anterior descending artery, often called the widowmaker. Thanks to his quick response and the steps he took while waiting for help, Richard suffered minimal heart damage. 6 months later, he was back in his garden with some medication adjustments and a newfound appreciation for preparation. "I always thought if I had a heart attack I'd know instantly," Richard told me during his follow-up. "But the symptoms were nothing like I expected. If we hadn't had that conversation about what to look for and what to do, I probably would have just sat down to rest thinking I was tired. By the time I realized what was happening, it might have been too late." Richard's story isn't unusual in my practice. I've seen countless seniors survive serious heart attacks with minimal damage because they knew exactly what to do in those critical first minutes. Now you know the 7 life-saving tips that could make all the difference if you experience a heart attack while alone. Remember, recognize the unique warning signs in seniors. Call 911 immediately. Take aspirin correctly. Position yourself for survival. Control your breathing. Use self-administered chest compressions in extreme situations. And most importantly, prepare your heart attack action plan now before you need it. If you found this information valuable, please hit that like button and share this video with someone you care about. You might just save their life. Subscribe to our channel for more life-saving advice specifically designed for seniors. In the comments, let me know which of these tips surprised you the most, or if you have questions about creating your personal heart attack action plan. Remember, knowledge and preparation are your strongest weapons against heart disease. Until next time, this is Dr. William Carson wishing you heart-healthy days ahead.